additional premium. And at the end of the day, whatever is left after they pay for your health care, they get to keep. Of course, many of them are nonprofits, so they can't actually keep it as a profit, but they could utilize it for whatever their desire is. So then, why have an additional insurance? Well, Americans like choice, and people feel that they need a choice of insurance companies. Those of us in a single payer world, we feel that you don't need choices of insurance companies. What you need is choices of providers. You need a choices of all the hospitals. As a matter of fact, you'd like to be able to go to any hospital within the area close to where you live, and you would like to go to any doctor. So for the most part, traditional Medicare, that's what you can do. If you fly to Florida, if you're a retiree who spends half your time in Florida, if you have traditional Medicare, it will work there. When they designed the Medicare Advantage, it was based on a county basis. So the premiums and the capitation fees that these companies got and their catchment area where they could operate was based on a state and county basis. So if you have an Advantage plan, chances are that plan won't cover you outside of that area where you live. So why would one want an Advantage plan? Well, there are benefits. One specific benefit is that there is a limit on the total amount of expenditure. Medicare doesn't cover you for an unlimited amount of coverage. When you get Medicare, actually has limits. It has limits based on your hospitalization at 60 days, and it has limits after 90 days, and it has limits overall. It also has limits in terms of the Part B portion that is paid out. When you are in a Medicare Advantage plan, there is a fixed limit. Usually the government said some after $6,000 or so, and I'm using broad numbers here just to give you a sense. At around $6,000, you could you don't need to pay anymore. The plan would cover it. So I've pointed out, so there is a difference. Another difference why one might want to have an Advantage plan is because there are certain things Medicare don't cover. They don't cover dental. They don't cover certain things like eyeglasses. They don't cover exercise programs such as going to the gym. They don't generally cover over-the-counter medicines in the Part D plans. So Advantage plan tend to give you those perks. So there are little additional perks. So the law that established Medicare Advantage was designed in such a way where it was supposed to remain neutral. It shouldn't go, we shouldn't be spending more money on the Advantage plan, and we shouldn't be spending less money on the Advantage plan. It should have some sort of parity with Medicare. So, people don't make money taking care of insurance companies shouldn't or generally don't make money taking care of very sick people. So if a middleman, which is what an Advantage carrier would be, a middleman, because there is still Medicare and Medicare is still collecting the premiums and Medicare is still backing the whole thing. So this middleman, how do they make money? Well, they make money by savings. Where do these savings occur? One, these savings occur because Medicare by itself does not negotiate with providers. Medicare does not generally negotiate with hospitals. Medicare has a set fee schedule, and that's it. However, these middlemen, they go and they negotiate. They negotiate with your providers. So they say, Dr. Moore, okay, Medicare pays $100. We'll give you $96 uh, for this same service. And the reason why you want it is because we've got these 30 patients and these are your patients. We sign them up. And the only way you can see them is you're going to sign a contract with us. And I want to keep my patients, so I sign and I get $97 instead of $100. So they save money there. They also save money supposedly because they're more efficient. But what we know, and I'm sure you've heard this, those of you who have studied this, that Medicare actually operates much more efficiently than these other Medicare Advantage plans or privatized Medicare companies. They generally take out of every dollar, they usually take somewhere around 10 cents up to 20 cents and even 30 cents out of that dollar to administer the program, where Medicare takes only about 2 to 3 cents to do it. So we know that Medicare is more efficient because of its size and because of everything else. But these companies somehow are able to make their stay in business. So those are the two ways. One, they negotiate lower payments to the provider, and the third way in which they make money is they adjust risk. There is risk adjustment. So after they have provided the service, they can go back to Medicare and say, listen, we insured 10 of your Medicare enrollees, but we found out that 3 of them really had more medical problems than the standard. And so we would like to adjust that risk. And Medicare would actually give them an additional amount. So they don't lose money. As a matter of fact, they make money. So there is a middleman somewhere. So the idea is, do we really need this additional layer? Well, it appears that many of our legislators, many of our administrators seem to feel that a privatized insurance company will save money, at the top. So I want to just say one last thing before I stop is that we think that a single payer is just not possible. And a single payer is probably not necessary because in our multi-payer system that we currently have, we're doing just fine. I want to point out, though, that when COVID-19 came, when we got hit with this pandemic, we moved the important part of our healthcare system to single payer. Testing was a single payer event. The testing was covered 100% by the government, and it's the government that distributed, approved, and basically managed the testing. And it had its problems, but it seemed to work. When we wanted to make sure that everybody who got infected with COVID 19 had health coverage so they could go to the hospital and they could be part of our public health protection plan. We covered their hospitalization 100%. And finally, when we got a workable treatment, the COVID 19 vaccines, we didn't distribute it through our Advantage plans or even our Medicare plans. We went single payer. We basically had it distributed in the way that healthcare probably should be distributed, which is a single payer, putting everybody in the country in one risk pool, and then have a standardized coverage for everybody. So that's sort of the difference between the two: Medicare Advantage. Medicare Advantage has a limit out of pocket payment. Medicare Advantage covers additional items such as gym membership and over the counter medicines. They both have the same serious coverage. When you go to the hospital, whether it's for to deliver a child, whether it's for a serious medical issue, both Medicare and Medicare Advantage would cover. I'll stop here. Thank you.
Okay, thank you. We are going to take two or three questions that possibly Dr. Moore can answer. I also want to say lots and lots of great questions are coming in. And sadly, we cannot answer all of these questions. I think you all realize that. But we are going to gather these questions and we're going to talk about them. And there should be no change in our plan until we get those answers. So if you have a specific question for Dr. Moore.
Well, we're going to ask you if you have a specific question, please raise your hand in the chat. I'm sorry, yes, in the chat. please try to make a comment within the Q&A as to what your question will be. That'll kind of help us make sure there isn't a repeat. We're only going to be able to take 2 or 3 questions right now for the doctor, and we're just going to really take it at random right now. But if you can also put it in the Q&A, that might be helpful for us. And we'll try to promote a few of you to have your mic on to ask the question to Dr. Moore. I'm going to start off with Carol Lang. Carol, I'm going to promote you to panelist. Just check that you're unmuted in a moment. Carol, you should be live.
Very quick. I maybe I misinterpreted Dr. Moore, but I got the impression that he said that essentially the Medicare Advantage and the Medicare are pretty much the same thing. When, I mean, that wasn't my experience at all. And my experience is that I had to go to specific doctors. I had to pay for procedures that I wouldn't have had to pay for Medicare. So, you know, it seems to me that the reason why we privatize it is because the company wants to make profit on the backs of the people who are the retirees. If I misunderstood, I'm sorry. That was the impression that I got that you said.
No, you did not misunderstand. What I said, and I will repeat, is that the coverage you get from both are theoretically the same. But you make a really very important point. Medicare signs up practically all the practicing physicians in the United States. Most all of us are Medicare participants, but most of us don't participate in all the various Medicare Advantage plans. So, for example, if you just show up to a random physician and say, "Do you take Medicare?" there is a 97% chance that physician will take Medicare. But if you show up with an Advantage plan, and I'm going to throw a name out there, let's say it's a United Healthcare Advantage plan, and you come to me, chances are I don't take that plan. And you might find, if it's an HMO plan, that only 40% of the physicians in that area will take that plan. If it's a PPO plan, maybe 60% of the physicians in that area will take that plan. So when you're in an Advantage plan, if it's an HMO, you have to stay in network. If you go outside the network, then you may not have coverage. If it's a PPO, which is a preferred provider organization, you may have some out-of-network coverage, but that out-of-network coverage is going to cost you more. So again, both Medicare and Medicare Advantage are providing similar coverage, but whether you have access to the physician that or the provider that you would like to is much, much less in an Advantage plan. And some plans have very narrow networks where there is just a few hospitals and a few physicians and a few providers that you'll have access to. Some will have larger ones. So your point is correct that when you actually begin to access the care, you will find that it's not the same experience as the traditional Medicare, which has a much wider, a sort of a universal network.
Carol, your reactions, anything you wanted to add?
Yeah, the other thing is my experience it wasn't just being outside or inside, but the procedure that I had to take. I had to get an MRI. For the Medicare Advantage, it would cost $350. For Medicare, it would have cost nothing. When they told me that I get dental, I believed them. And in fact, when I asked them again, they said, yes, if you break your jaw, you'll get dental. So essentially, everything they say to you, anybody who's thinking about this really has to ask very specific questions, because they lie or they obfuscate. And so you're not really getting what you think you're getting at the end of the day. And in order to make profit, I think that we have to all understand that the Medicare Advantage is about making profit because it's private. And so we should be in opposition to anybody being put in Medicare Advantage, and we should denounce the union leadership and de Blasio for doing this to us in the first place. So that's my reaction.
Thank you so much, Carol. I wanted to promote, I believe it's Enid or Enid Weinstein. Enid, I'm going to promote you to a panelist. Carol, if you can put your mic on mute. And Enid, I am going to promote you to a panelist. What is your question for Dr. Moore? Enid, you should be on. Enid, what is your question for Dr. Moore? All right, so Gloria, if you can put that mic on mute for Enid, and I'm going to take another person, if you're able to scroll there. John Breitbart, I am going to promote you to a panelist. Do you have a question for Dr. Moore? And Dr. Moore, if you can, is there an email address or a way that others can contact you with additional questions that are germane, so that we can move forward with some of this conversation? We're going to take one or two more folks, but is there something, maybe in a moment you can tell us where you can be reached as
Yes,
well?
I'll put it in the chat.
Okay. John, your question for Dr. Moore. John Breitbart. John, are you there? John, you've been promoted.
Hello, hello.
Yes.
Hi, thank you very much for taking my question. Mine is somewhat, well, let me ask Dr. Moore, but it may have different implications. Many people want a single payer medical coverage. If people want Medicare for all, which means social coverage by the government, the more people who are either forced or opt into Medicare Advantage plans, essentially this eats away at the amount of healthcare that's being provided directly with the high efficiency of the Medicare government coverage. And I wanted to ask what your opinion is about the political implications that, in other words, Medicare was established as a way to socially provide universal health care. And now with the Advantage plans, from the consumer point of view, from the patient point of view, things are immensely more complicated. It's not only more complicated for me, but like I go get allergy shots, for instance, from a company that provides them in New York City. And their accounting department can't even produce a proper statement, because in order for each of my little transactions, like I go for monthly shots, they have to provide a claim to Medicare and a claim to my Medicare, in this case, actually currently a supplemental Medicare program with GHI. This is fantastically, they're sending me statements that aren't accurate. So that I would like to point out that there's an important political aspect to this that underlies this policy process. And that I think that the unions and people who want to support Medicare for all need to understand clearly that we need to stand up for socialized universal medical coverage, and that that's a political thing at the same time that it's a service concern for patients.
Thank you for that. It's certainly political, but it goes beyond that. It certainly sounds that you do have the understanding of insurance. And the way insurance works is it's that risk pool that protects us. Why Medicare is so powerful is because of the large numbers that are in it. I mentioned earlier, we've taken now 30% of that massive risk pool, and we have transferred it to numerous not one, two, three, but numerous smaller insurance entities. Many of them are not even insurance companies. So what we have done is we've taken the great concept of risk pooling and we've divided it up into tiny little pieces, which means it's costing us more. So we've basically increased the cost of providing healthcare. In addition, I think the point that you're making is the whole concept of equity. Um, I'm taking this a lot further than maybe we thought but I'll bring this up. Equity. The reason why these advantage plans came in the first place was to provide care for people with lower income. We didn't, we as a society did not want everybody to have the same insurance. We wanted to maintain the good Medicare for us with good income, and we wanted to make sure that the other people with lower income got a different Medicare. The problem with that is that it eventually catches up. I think Martin Luther King said, injustice anywhere is a threat to justice everywhere. So this separate insurance that we were provided for people with lower income, it is now what the society, or at least the powers that be, wants to promulgate throughout the middle class and the rest of the population. So yes, there is an equity issue, and of course there is, I think, weakening the risk pool. And part of the whole idea is that Medicare was supposed to improve things for seniors over 65, and it did. We are now moving backwards, as we're seeing with this particular union. And this is not the first union to do that, incidentally. 1199 did the same thing with their retirees. The retirees, I think, are the easiest group to take the benefits from. And once you take it from the retirees, then you will move down the chain, and pretty soon you're going to be offering just HMO plans to the actual union members.
Thank you, John, for your question. Sheila, you're going to be our last question. And Dr. Moore, I know you said you'd put it in the chat, but if you could just tell us where they can reach you.
Yes, so my email is drmooreandassociates@gmail.com. So the way that's done is drmooreandassoc@gmail.com. So I didn't spell out the associates, ASSOC. I started to put it in the chat. I'll do that in a minute.
All right, Sheila, you'll be our last question, and then we want to move on to our next segment. Sheila Zakowski, if you can unmute your mic, you're on with Dr. Moore.
Got it. Okay, so I think one thing that I didn't hear, at least maybe you mentioned it, is that in Medicare Advantage plans, the insurance company has a panel of whatever, nurses, whatever. They make the decision as to whether or not services are medically necessary. So you may deem a service medically necessary and they may deny it, and you don't end up getting that service that you believe that you may need, and perhaps your doctor thinks you need too. Probably your doctor thinks you need.
Yes. So as you get into the weeds of these things, then you realize what the differences are. In general, Medicare does not require prior authorizations for things like CT scans, MRIs, and most procedures. Medicare basically assumes that the physician or the provider is doing the appropriate thing, and they do retrospective review, but you generally don't need a prior authorization. However, that's not the case with Advantage Plan. It's not the case with HMOs. It's not the case with PPOs. Now, there are two aspects of that. One is to make sure when you get a prior authorization that the doctor did order the appropriate thing. Of course, as you just pointed out, most of the review is not being done by the peers of physician. It's being done by people who are given protocols to follow. So that's so that's one thing. But the real reason for this obstacle is to slow down the process and hope that if somebody has to go the extra step, they won't and service will not be provided. I mentioned to you earlier that the amount of money that is coming into the system is the same whether you're in a Medicare traditional plan or you're in the Medicare Advantage plan. But there is a middleman who now has to make money. And that middleman who has to make money, they will only do it if they can skimp on services. So how do you not provide a service? You not provide it by delaying the service. You not provide it by denying the service. So there are various ways in which these insurance type entities can actually save on the cost of actually providing care. So that point is absolutely correct that you made. Thank you.
Okay, thank you. Thank you so much. We're going to move along to the next part of this, but I also just want to remind everybody that we can't really right now be talking about.
You're muted,
Can't hear
Gloria.
you.
I'm sorry.
Sorry. Hi. Okay. Thank you. Thank you, Dr. Moore. We're going to move on now, but I just want to remind everybody that right now, although we want, many of us want Medicare for all single payer, we don't want to talk about it at this event because we need to first educate ourselves as much as we can about what's going on. I mean, I'm learning a lot because I was confused, and many of us are confused about what the difference is between Medicare and Medicare Advantage. So, and we also want to talk about, we want to make sure we have time to discuss what can we do to stop this or at least get a moratorium on it until we do understand it. So we're going to move now into more of a open discussion. And you've already seen Daniel Alicia. He knows really well how to do the technical part of this. We're teachers. We've never had to do this before, not when we were teachers. So Daniel's going to moderate it, and I'm really proud to introduce Daniel, who is a special education teacher in Far Rockaway. He is also the lead organizer of the Educators of New York City community.
Again, welcome everyone to Retiree Advocate Caucus's forum tonight. And we were going to move forward. We've invited several panelists from some of our caucuses, including one of our unions, PSC, which is the Professional Staff Congress of CUNY. So we have a few panelists tonight that are going to give some reaction to some of the things we've heard, including reactions to the process of how we got here. And so tonight we have with us David Kotelchek from the Professional Staff Congress. We also have Gregory Lee Stefano with a New Action Caucus. We have Jackie Lyle of the Solidarity Caucus, James Eternal with ICE, the Independent Community of Educators Caucus, of UFT, Marion Swerdlow of MORE, Movement of Rank and File Educators. And so we've got some framing questions tonight. We're going to start off with some of those framing questions with these panelists based on some of the information we've got from Dr. Moore and some of our other panelists earlier on today. So here's some of the ground rules. Again, we want to make sure we're moving forward. So we're trying to keep things in a timed fashion and also just keeping things relevant. We're asking that if you are an attendee, you're not a panelist, if you have a question or something that you want to add, please raise your hand on the bottom icon on the bottom and try to add it to the Q&A. We're trying to get to as many as we can within the Q&A portion or in that dialogue box, but we will try to promote some of you as panelists as well to ask your questions to this next panel. So starting us off, David, what we're going to do with these panels, if you could just introduce yourself, tell us your affiliation, and in 3 minutes, give us an opening statement to what is transpiring tonight. So David, if you could start us off.
Yes, good. Can you hear me? Okay, good. My name is David Cuddlechuk. I'm a retired faculty member from Hunter College and an active member of the Retirees chapter of the Professional Staff Congress of CUNY. Let me talk more from inside the union. I am a retiree now. And by the way, I don't represent the PSC, nor do I represent the chapter. I'm an individual activist in the chapter, concerned about what's going on and supportive of what our chapter is doing, but I speak as an individual. This proposal, and I'd like to speak now inside the healthcare that's delivered by the city of New York to retirees. This proposal is an outgrowth of the June 2018 agreement between the city of New York and the Municipal Labor Council to save $600 million for the city in fiscal year 2021. The Municipal Labor Committee represents 100 municipal unions, including the UFT and the PSC, both of which are, of course, chapters of our national union, the AFT. Most retirees inside the system, most retirees and our spouses are Medicare eligible as retirees. Traditional Medicare, as noted before, covers 80% of the costs for what they call Part A and Part B, hospital costs and doctor's costs. The other 20% has to be provided. It's not provided by Medicare. In New York City, the New York City through the MLC basically provides the other 20%. In other words, you get 80% from the federal government under Medicare, and then there's 20% that has to be covered somehow. The city pays for that. And in addition, once the city pays the 20% for hospital and medical costs, we all of the locals, almost all the locals in the city, have some sort of welfare fund where we get our drugs, our dental coverage, et cetera, and other services. Okay, now this movement to go to, they put out the MLC and the city put out, or the city put out a request for proposal for people from Medicare Advantage plans to cover our retirees. This is a retreat from Medicare, from federal Medicare to a privatized for-profit hospital system, a healthcare system, and frankly, more problematic coverage. These optics don't look very good, it seems to me, for a progressive union, which is on record for healthcare as a public good, affordable by everyone. Our union nationally supports Medicare for all. And what we're doing is moving back to a private for-profit system. When the agreement, the 2018 agreement was determined by MLC and the city, they said there were 8 different areas that they could cut medical costs, healthcare costs. Only one of which has really been explored. And this we got from our representatives on the MLC, our unions, our locals representative on the MLC. The only one they really looked at was taking retirees from Medicare to Medicare Advantage. One of the items that was listed, the first one, in fact, was self-insurance. New York City is one of the very few large cities in the United States, possibly the only one. I can't give you a specific, we are one of the few that don't self-insure. Big cities self-insure. We're talking about savings that might be even more than the 600 million that the city is currently talking about taking from our health benefits. So the transparency of the negotiations between the MLC and the city are really, it's been more or less secret. We spent months in our local trying to find out what is going on, and we don't know. And we can't answer important, specific questions. Will there be copays? Will all the hospitals in New York City accept the Medicare Advantage? For example, Sloan Kettering, the famous cancer research hospital, Sloan Kettering does not accept any Medicare Advantage plans, none. Well, if this is adopted by our MLC, will Sloan Kettering do that? The Hospital for Special Surgery in New York City only accepts one type, as Dr. Moore talked, one type of Medicare Advantage. And it's not one, as far as I know, it's not one that's being considered by the MLC now. These are all important questions, and we can't answer them. We've been spent months to try and get the information. And we still, as Gloria said, we still don't know. The one thing I will say is that our local, our chapter had put a resolution up to the delegate assembly of our local, and that asked for a moratorium. It asked for a moratorium on any agreement because municipal retirees affected by the proposed changes to retiree coverage have not been provided adequate and timely information, nor have we had opportunities to discuss and debate the controversies around the Medicare Advantage plans and the personal effects of such a change and its policy implications. And our delegate assembly voted unanimously, 115-0, that we would ask for a moratorium and no decision to be made. And we have been talking to our members about this. I would be very glad to talk more now, and maybe in your questions, about technical details of our particular plan. The one thing I can say, and I should say, that our people our welfare fund people have said to us is, any doctor who accepts Medicare has to accept Medicare Advantage. In other words, Medicare Advantage and Medicare they are required by the federal government to cover the same services. So there's the basic minimum services that whatever plan you take, Medicare Advantage, they must cover. And that's an important thing. However, as we know, for many other Medicare Advantage plans, many things happen over time as Medicare Advantage tries to pay less money to the doctors or less money to the hospitals. They get in fights. And what happens is doctors drop out of the program and hospitals stop accepting Medicare Advantage. And there's been some discussion of that in the papers in New York recently. So the networks narrow. We are being promised lots of things up front in the first Medicare Advantage proposals, a 5-year contract. And they said, we will insist that they don't cut the doctors' fees, that the doctors will get what Medicare gives. And that's good. But over time, with paperwork and permissions required. Over time, the networks get narrower and narrower, and people find they can't go to the doctors they're used to going to. And we're retirees. We spent 20, 30, 40 years finding the best doctors for us. Will we have to change them? And doctors can drop out of the program. They can say, I don't want to take Medicare anymore. I'm sorry, I don't want the paperwork. And we're stuck, right? And they can't, I don't believe they can promise. So we need to find out from what is actually going to be accepted by the MLC, find out what it entails. And we need that information. Okay, I hope that's helpful.
Thank you so much, David, for giving us, really kind of framing this for us. So we're going to go through these intros. I'm going to ask the remaining panelists if we can keep our remarks to about 3 minutes. I do have a chime that to just kind of remind you to try to bring your thoughts to a close. And because we still have a few other questions that we want to get to. Gregory DiStefano, if you could introduce your affiliation and kind of just introduce your stance right now.
Yes, hi, thank you very much. My name is Greg DiStefano. I'm a member of the Retiree Advocate Caucus. I'm also a member of New Action UFT, a caucus within the United Federation of Teachers. I previously served on the UFT Executive Board representing high school teachers. When I was on the Executive Board in the late 80s, early 90s, Sandra Feldman, when she was president, formed a health committee. And she assigned, people to serve on that committee, and I served on that committee. And there was very much transparency. We had people visiting from GHI, from HIP, Blue Cross Blue Shield, and whenever changes were going to come about, it was discussed in an open matter, unlike what's happening now. I know Michael Schumann and everyone has said about the $600 million that they want to save in 2021, and that's going to go up to 1.1 billion they're looking to save. And Dr. Moore stated correctly, after they get done with the retirees, they're going to try to put this on active members. Dr. Moore summarized the differences between Medicare and Medicare Advantage. And I just want to make a point. He's from Weill Cornell. I've had experience. Last year, I needed surgery. I needed my aortic valve replaced. My cardiologist in Staten Island wanted me to have open heart surgery at Staten Island Hospital. Well, I did my research, spoke to a number of people, and I went to Cornell Weill, and they have what's called a valve department there. They specialized in this procedure. I had the surgery in May, and I went home the next day. So I managed my own health care, and that's what we want to be in charge. We want everyone to be in charge of their own health care. And I had a friend also that needed cancer treatment, had to go to the University of Houston, which specialized in the type of cancer that he had. We're not sure now that if he, he would have been covered. So this is the most important thing, is that we remain in control of our own health care. The unions are negotiating with two private entities, Aetna and a coalition of Emblem Health and Empire. All right, those are the two finalists. Okay. So we have many questions now. What happens if we decide not to take Medicare Advantage? We can't force to be required to take Medicare Advantage. But if we don't, okay, what happens to the reimbursements we're presently getting of our Medicare from Medicare Part B? Will our payments for what we have now, GHI Senior Care, go up a lot? What about our IRMA reimbursements that we presently get? Are those reimbursements only going to be given to the people who decide to go into Medicare Advantage? In summary, we have a lot more questions than answers. I agree. We have to call for a moratorium and what they're trying to do now. Okay, and if the city is so looking carefully on how to save money, maybe they should look to increase the revenue stream from Wall Street, which has made, tons of money in the last number of years, put in a stock transfer tax, which we had up until the mid 80s, okay, and stop trying to save money based on the backs of retirees who worked for this city for many, many years, and in many cases worked for low wages, below what other people were earning in the private industry and in other municipalities. So I think that I want to thank everybody for having this and participating. Thank you very much.
Thank you, Greg. Thank you so much. Jackie, Lyle, you're up next.
Can you hear me now?
Yes, we do.
Okay. Hi, I'm Jackie Lyle. I'm a retired teacher, a former delegate, and a member of Solidarity. And I would briefly like to touch on some of the points made by earlier speakers. That labor union agreement, the municipal labor union agreement, was instituted or came about in 2018, but there's really a little more of a backstory to this. A friend of mine was attending a meeting and she's a member of the CSA, and she was listening to Dr. Doug Hathaway, who is the CSA administrator of their welfare program. He stated at a meeting as recently as April 27th, he was speaking to his members. He said some of this change came about when the unions were trying to settle their contracts. Bloomberg would not settle with the unions because he was trying to cut healthcare, and finally de Blasio agreed and they did settle the contracts. But in order to get retroactive pay, this healthcare agreement came about that we would have this huge savings, 300 million in 2020, 600 million in 2021, and every year thereafter. So it's a very healthy, very, very weighty savings, I think, for a retiree to have to put forth. And my point is, it's a complete reversal of the union's position. On their website, they have stated, and they have this proposal, I think it's a resolution from 2010, that they are opposed to private healthcare. So the fact that we're feeling very blindsided is correct. We are getting blindsided. And in addressing the question, that framing question, will it diminish our healthcare? I think we've kind of come to that point. Yes, we understand it is going to diminish your healthcare. If we change to Advantage Care, it's a money-saving vehicle. What action should we take? It's my position that we have to get more time. The municipal labor union agreement is scheduled to have this change take place July 1st of this year. Now we're already in May. So all people who are affected by this really need to familiarize themselves with the program, and they can't do that because it's not in place. Nothing is nailed down. In addition, as a Medicare recipient, we have the right to do a little comparison shopping. We have the right to look at other plans and other companies that are offering something as far as Medicare goes. If you want to get advice from the state, there's a state agency. It's funded by the federal government and given to the states, the State Health Insurance Advisors Group, and the number is 1-800-701-0501. And they will give you advice in exchange, but we really need to have more concrete information to go to those people and find out what's best for us. We can't even give them enough to get advice. We need more transparency, absolutely. And we should be able to either hear or to see or to have some kind of access to the negotiations that are taking place, since they affect us. And it just isn't right that we are sort of shut out of this. I also feel that we should not be the only group who has to bear the brunt of this forced savings. We are at a point in life where good healthcare is very needed. People who are in the beginning of their career, 25, 30, I hate to say it, but they're less likely to need an oncologist or a cardiologist. At our point in life, we really may need somebody. So we really need to look at what other ways these savings could be done. It seems like a very harsh and very draconian type of thing to force retirees to do this. In addition, I think we also need to be given the option to keep our traditional Medicare at some kind of an affordable rate. And I guess basically that's it. And I'm also thinking that what about people who had no knowledge that this change was coming? I mean, it was really a long time coming. The union chose not to tell us. And now we're in a situation where we're sort of floundering around wondering what to do. So is it possible to get the idea or the provision that could we be grandfathered in to keeping our regular Medicare, and going forward, other retirees would have knowledge of these changes and could then plan and budget for them? You know, that we're not in a position to do that. This is being forced on us. So I think that's my position, and I'm going to yield to the next speaker.
Thank you, Jackie. Marion Swerdlow, if you can introduce yourself and your affiliation and where you stand. I think you're muted currently.
No, I don't think I'm muted. Okay, so my name is Marion Swerdlow, and I'm representing the movement of rank and file educators or more tonight. Okay, the more opposes any change to a private health insurance. We are in principle opposed to privatization of healthcare. The city and Unity and I guess other union leaderships also have been trying to imply that any provider who takes Medicare will accept the Advantage Plan. They've used vague language like in Mulgrew's letter of April 26th. He says things like, quote, a member must have access to the same doctors as well as having the choice of any Medicare eligible providers. I think that Dr. Moore made it very clear that this is not accurate. I think those of us who are longtime UFT members, we know that we can't always trust our union leaders to give us an accurate picture of what's in what they are selling us. But they're trying to create an impression, and it's almost certainly misleading. David Kolachek and Dr. Moore and others have given excellent information. I can't add that much more. There's an article in the PSC newsletter that Gloria sent out, a different kind of Medicare Advantage, ? By Bonnie Nelson. And she studied Advantage plans imposed on teachers all over the country. And she found that that they definitely, there are many providers who accept Medicare who will not accept Medicare Advantage, as Dr. Moore said. So, and it isn't just keeping your doctors in choice of providers, although that is essential. If you have a medical emergency, you'll be taken to a hospital, you'll end up in a hospital. And when you're in the hospital, every provider who walks by you bills you. And although not all of them take Medicare, even fewer of them are going to take any particular Medicare Advantage insurance, which is logical. You can't force a doctor or a medical group or a hospital to accept any plan. So also, one thing that we haven't addressed is we have no idea what will happen with deductibles and copays. We don't know what the actual text of the plan is, whether we'll have to pay copays, whether the deductible will rise. But Advantage plans are for profit. The profit has to come from somewhere. Dr. Moore mentioned that MA plans negotiate with doctors to try to pay them less reimbursement. Well, that's going to drive doctors away from Medicare Advantage plans. And a lot of people are asking about about the benefits we now get from the welfare fund, like optical and dental, whether we will still have those if we don't accept the Medicare Advantage, and if we stay on traditional Medicare and opt to buy our own supplemental. I've priced out some supplementals, and they are not the ones I've found are not as high as what Rita's been putting in the chat. The United Healthcare plan that's pretty much identical with ours is $200 is $200 a month, and then there's a drug plan that's about $40 a month. That's comparable to what we have, which is shit. And so this is a very bad idea. Whether we can stop it, I don't know, but Moore is definitely against it. We'll cooperate in any resistance that people initiate.
Thank you so much, Marion. James Eterno, you're up last as an intro, and then we're going to do our first framing question. Will be as listed, but we'll give each panelist about 2 minutes to respond for that one. James, if you can introduce yourself. Thank you, Marion.
Good evening, everybody. I'm James Eterno. I represent myself, basically. I'm part of the independent community of educators and also running for an exec board position with the Retiree Advocate in the chapter elections this spring. I heard a lot here this evening. I heard plenty of questions, tons of questions. I don't have anything more any great insight to add to what has already been said. Following Dr. Moore is tough, and David and Greg and Marion, great questions that everybody asked. But it seems that there's kind of a consensus here that we are taking a giant step backwards with privatization, and that the companies, whichever company wins the bid, is going to have to make some money, and eventually, maybe sooner, maybe later, it's going to come off of higher payments from us. So people want to ask these questions not to us, where we can't provide many answers, but to Mr. Mulgrew and other people at the MLC. Well, Mulgrew is giving a town hall for retirees on Tuesday afternoon. And what I want to spend my minute or so talking about is how difficult it's going to be for any of us to get any of these questions through that everybody has tonight to get to him. So having changed to remote kind of meetings since March 2020, in UFT meetings, it's basically staged. Think of it as kind of like a radio program, a talk radio show. First, the host, who's Mulgrew, gives about a half hour, hour and a half, or whatever he wants to do, monologue. And he's going to give a monologue on Tuesday saying, this is the bestest thing ever. You can count on that. And then there are pre-screened questions. So only the select few get in their questions. So we will be very lucky if we get one or two that are even asked. And maybe we could think about doing something about that here tonight. Now, if you think, give you some examples of what I'm talking about. Our host, Daniel, had a resolution, I believe it was back in December, that he got wide support to put it on the December agenda to limit mayoral control and to have a discussion on that topic. Well, it is May. That topic still has not been addressed by the DA. Last month, Michael Schertzer, probably the only independent left on the UFT executive board, he came with Retiree Advocate's resolution of calling for a lot more transparency in this process on changing the healthcare. And that was buried in the agenda. I very much doubt it will be taken up in May. I very much doubt it will be taken up in June. And this thing is going to go sailing through before we even know it. So if we want to be heard, we're going to have to do something. Now, there is a town hall, as I mentioned before, on Tuesday. And what are we going to do? Well, I think one of the things we can do tonight is to coordinate our questioning. So if a whole bunch of us are in there asking some very difficult questions, very probing questions, fair but probing questions, then I think they'll have much less of a chance to not put them through. And I just want to say, we can sit politely and hope that one or two questions will ask, but we also have to remember, I'm pulling out the UFT Constitution here, that it says, Robert's Rules of Order, I'm reading Article 13, Section 3. Robert's Rules of Order newly revised shall govern the conduct of all meetings of all bodies except where otherwise provided in this Constitution or in the bylaws. Well, the retirees are a body of this union. And so I think we should insist on Tuesday when the screener opens up the phone lines, it's time for 100 of us to press 0 and all be ready and do something there. So that's what I'm proposing we think about here tonight, that we have a coordinated strategy for Tuesday. Thanks.
Thank you, James. I want to thank our panelists. And so this first framing question, if we could do this round a little bit quicker, we have some framing questions, and then we definitely want to get to some of those questions as to action, a call to action for this proposal and anything that might happen after. But I'm going to throw out this first question, and then we may get a couple of participants, attendees, to also add comment or question. So the first framing question for our panelists, and again, if you can answer within two minutes, that would be great. First question is, based on everything we've heard, we know come Tuesday, whatever is being proposed is going to be proposed very likely in the most positive light. So we're going to probably hear that your healthcare will not change very much. It will not diminish, and it might even be improved. How do you react to this? How do you react to this, panelists? If the town forum on Tuesday, we get to hear that it's not going to diminish your coverage. It's actually going to improve it. What's your initial reactions to that? And we'll start with David K.
Sure. First, we can't know what will happen when we take the Medicare Advantage. I believe there's a fair chance that a number of doctors will simply opt out. Medicare Advantage has been worked on around the country for years. People and doctors, people including doctors, know what to do, and that they know they have a lot of paperwork. They have to get prior approval to do things. The doctors have to listen to some insurance person who's not a doctor, typically, tell them what to do. So they will try to minimize the impact of this change on us. But over time, it's going in the wrong direction. It will diminish our healthcare coverage. If it doesn't this year, over time, it will.
Thank you, David. Greg, diminish, improve, your thoughts?
Well, I think that this, again, for me, the main thing is who is going to manage my healthcare.
That's right.
And the only person that should be managing my healthcare is myself, in consultation with my doctors. So, and also, right now, the medical coverage that I have, I'm very satisfied with. It's affordable, and I want the assurance that there's going to be no diminishing of what I have right now, and no one is going to manage it for me. That's it.
Thank you, Greg. Jackie, diminish or improve, your thoughts on that?
I would have to say that it would be diminished. And I don't think that Mulgrew can state with any authority that it's going to be improved, because the particulars of the plan have not been hammered out. It would really be important to know if there are co-pays, is it an HMO, is it a PPO? All of that has to be on the table so that we can clearly see. And at this time it is not, and that's why they're claiming they can't share with us a lot of information about the plan. It's all going to be great, but they can't share it yet. And if they don't have all the particulars ironed out, that is not a truthful statement. So that's my opinion.
Marion, will this diminish or improve health coverage?
I agree with the previous speakers.
Thank you. James, thoughts on whether this diminishes or improves coverage?
We obviously don't know because we haven't seen the plan. So my position is, if it's so great, why don't you show it to us before you sign off on it?
All right. If you want to add comment right now, the mic will be on. If you raise your hand in the chat, the question is, do you think this will diminish health coverage? What if you're told that it will improve it? Your thoughts on that? Again, raise your hand in the chat and we will patch you in as a commenter here in a moment. Jessica, I'm going to patch you in. We'll take a couple more after Jessica. Jessica M, you're on. Jessica, if you unmute your mic, you should be ready to go. I'm going to ask you to unmute. Are you there, Jessica?
Okay.
All right, Janet M. Mascusa. Sorry.
Mascusa. Hey, Janet.
Go ahead, Janet. You've been promoted as a panelist. Janet, just unmute your mic. I think.
Can you hear me now?
Yes, we can. Go ahead.
Okay. My daughter was laid off during COVID and was put into a COBRA plan, and she became very ill, needed surgery. The insurance company would not allow her to stay in the hospital after the surgery. They would not give her any of the coverage that the doctor had requested for her when she was sent home. She had complications, was rushed back to the hospital, had a second surgical procedure. That day, they said she had to be discharged from the hospital. And again, she could not have nursing care at home. It went on, and it was like, it was just so awful. And I didn't know if she was going to live through it, because she couldn't get the care she needed. And the doctor kept saying, I'm so sorry, but I can't give you care that the insurance company says they won't pay for.
Wow.
That's what we're looking at.
That's right. That's right.
Thank you. Gay Weissner, I'm going to promote you and I'll allow you to talk. Go ahead. You just need to unmute your mic.
Hi.
I might have muted you again. Try it one more time. Just unmute.
Can you hear me now?
Yes, we can.
Okay. I have a question. I understand the runners, the two possible choices, the Aetna and Employer Blue Cross Blue Shield. Somebody mentioned something about involved in that. Do you have any information that there'll be of GH an emblem for? Comment I wanted, I've part of HA about 40 first with him, with the Medicare Advantage for him. And while I've had more issues, I say I've never had a horror story or been denied that I needed. Well, I can't speak to Medicare around the country, but this has definitely been for me. And if that's whether or not plans which involved, I'd appreciate that.
I think the question, I know she had some of her audio broken up, but there are two finalists. Does anyone have any ideas as to advantages, disadvantages of any of those two plans? From our panelists?
No.
No.
An exact
No.
question.
We don't know what the plans are.
Well, I can tell you my husband had a temporary position with Emblem Health, and he was working the phones for the Advantage Care. And he said it was a nightmare. He said that people would call up and they would, they were kind of frantic. They would call over and over again to get prescriptions or to contact a certain doctor, and they couldn't get appointments because there was maybe one doctor in the plan and the doctor was booked up. So it really his experience echoes what our previous speakers have said.
More questions and answers. All right, our next question for our panelists tonight. We'd like to hear what actions can we take to prevent these changes from happening? Is there anything we can do now, actions that we can take to prevent this from happening? And I'll start off with David.
Well, first, that people should sign the Comro petition for a moratorium, where as of late this afternoon, we're 50 signatures below 10,000. We're going, so you can do that right now. And it's on the chat. Go there and sign it. That's one thing. And then others will make other suggestions.
Greg, any ideas?
Well, I agree. I just signed my petition last night. So that's the first thing we should all do is sign the petition. And if people want to have a demonstration, and we'll have to see if there's a groundswell for that.
For a rally.
Yeah.
Okay. Jackie?
I think the rally is an excellent idea. And I also think that in the rallies and in the petition, we should put forth the idea that either the negotiating process is either filmed or that we need eyes on this. It's not fair that we're shut out of this negotiation. We're affected by this. So I don't understand why we don't have a seat at the table at all, why it's being done behind the doors of whoever. I mean, we don't even know where this is taking place. So I think the petition is a great idea. I think the rally is a great idea, but I also think we should push to have a pair of eyes on this. I think it's only fair.
Absolutely. Marion, your thoughts as to actions to prevent this from happening?
More will support any action that's initiated by any group, and we will try to mobilize for it. The fact of the matter is that Moore is overwhelmingly very, very new teachers, people who are worried about getting tenure, and that they'll survive, that there'll be Medicare in its present form when they're 65 is, they question that. But we will do our best to mobilize for anything that's planned. But the focus of the group, for better or for worse, is on the problems of the newest teachers.
Thank you, Marion. James, thoughts on actions?
Very simply, a rally is great. I signed the petition, and I think for Tuesday, we could focus on bringing up the resolution that Mike Schertzer raised last month and demanding that it be heard and brought to the floor at the Delegate Assembly in May. I think that's something that we could have an impact on, and we have to make it that there's plenty of us that want that.
Definitely possibly get that listserv going to coordinate some of those questions. Might be an idea for a working group to do some of that coordination. We are going to take some questions or comments from those of us that are listening on what action should we take. I see Norm Scott has his hand raised. Norm, ideas on actions. I know you're part of Retiree Advocate.
Right. You hear me?
Yes, we do.
Okay, so I was asked to think through the issue of a rally, and let me do my video. Okay, to think through the issue, the possibilities of a rally. So here's what we know. We know the MLC, we heard, is meeting tomorrow with the steering committee, and then is meeting again Wednesday with the full committee. Now, it's not a vote per se. But it is a somehow some kind of a solution to which group they may pick. So, and we had some ideas if we were going to rally, that Wednesday was a possibility. And we didn't know, we don't even know if they're having a real meeting. They might have a Zoom meeting, but the symbolic place is that they're on 125 Water Street is their MLC headquarters. And we considered the idea of just picking out of a hat at 12 noon and gathering there as a possibility. However, that is somewhat of a sort of a shot in the dark as to how many people would actually go there and what would be the effectiveness, or if it was, say, 12 of us showed up, and would that make us look so ineffective and weak that it would be a laugh out loud moment for them. On the other hand, if we showed up with, a couple of hundred, it would have a different impact. So I'm framing the rally issue around those ideas. It's not absolutely necessary to go on Wednesday. We could probably have some time to hold a rally and build for it. So those are the issues I'm putting out in front of you for thinking about if you do want to do a rally.
So there is a poll. If you look at the bottom of your panel, there's a poll that asks, if you click on polling, it says, given that the MLC is planning to meet on May 5th, would you attend a noontime rally at MLC headquarters at 125 Water Street on that day to call for a moratorium on this whole decision? They are going to be choosing between the two finalists, I think Aetna and the other coalition, on changing our Medicare to a Medicare Advantage. So if you are willing to participate in a rally this coming Wednesday, you can check yes. If you're unable to attend, you can check no. But just to get a feel as to whether there is a groundswell for a rally. So again, use the poll, that's the polling option on the bottom. I'm going to take one or two more. Any ideas out there as to actions that we can take? If you raise your hand in the chat, I'm going to lower hands here in a moment. I'm going to lower all hands, but here's the question for our participants. Any ideas as to actions that we can take that have not been mentioned thus far? Stephanie, I'm going to patch you in as a panelist. Just unmute yourself. Stephanie R. Stephanie, you are patched in. Your thoughts on any actions we can collectively take?
Okay, can you hear me now?
Yes, we can.
Okay, all right. I don't see the polling thing, but going to Monday or Wednesday, whatever it is fine with me. But I also was just thinking that, and I had put it in the chat, that we could do a sit-in at the UFT building. And for people, I know it was discussed a little bit on the email, the listserv, that people said it's hard to get up, but we're sitting down for most of the time. So that's pretty easy. We could send out a big press release. It would be really embarrassing to the UFT leadership to have that going on. I doubt that they'd arrest us, but if they did want to, they would get plenty of time, when the cops say you have to leave and then get arrested. So people who didn't want to get arrested could leave, but we send out a big press release before, so we get lots of press there taking photos and interviewing people, and then probably leave after a couple of hours. But it would serve its purpose of really embarrassing the UFT leadership. And we could do both. We could do the Monday or Wednesday and also embarrass them by sitting in there.
Yeah, I'm hearing some old-fashioned civil disobedience here.
Right.
That's good with me. If you are interested in doing something this week, I see some of you are saying yes or no in the poll, but also if you could in the chat, if you are interested in taking any action in person this week, then in the chat, if you could put your name and email, and we will jot that down to get in touch with you. If you cannot see the poll, the other option is say, yes, I want to participate in some type of action, and just put your name in the chat and your email, and we will reach out to you. Retiree Advocate will reach out to you. All right, I'm going to promote one other person here as far as ideas as to actions we can take, and then we'll move on to our last framing question. Marilyn V. The poll should be visible now if you don't see it.
Can you hear me?
Yes, we can.
Okay, I think that I'm very interested in any actions that we take, including a sit-in, which I've never been in a sit-in before. But in this case, I think sitting in at the UFT office with very good publicity could be very, very effective. And I just want to follow that with a question quickly about my mystification over the fact that from my experience in the DA, many of the hand raisers every meeting who went along with anything that came from the podium were retirees who did nothing but come to the meetings with their cards every month and raise their hand. And they'll be affected by this too. So how is it that we are not, how can this be that these people don't care about what's going to happen to them? It's not just us. And they're old too. So what's the deal? Anybody have any idea on that?
Good question.
Good
We ought
retort.
to be able to make mincemeat out of this plan, because these retirees, I mean, they're human beings. This has to be something we can reach them on. If we can just get enough press and then have a sit-in and make our case with all the union newspapers and all the other press, I think all the ideas have been very good, and I think we should do them.
I agree. Thank you, Marilyn. Last question for our panelists. So this proposal hypothetically and very likely will pass, right? What's the next course of action if this does pass? Your thoughts, David, if this passes, what's the next course of action here?
Really, I don't know. Sorry. There has to be, we've been trying to get publicity out to people in other unions. If you know people in various unions, retirees, talk to them, get the word out. People don't know. Even if the MLC approves, the city has to have a hearing before the city signs its half of the agreement. And that we might go to city council people and try and get their support to put pressure on the city not to agree. Can be done.
Thank you, Dave. Greg, this likely.
I agree with the last speaker that to go to the city council for support. You know, I agree with that, and especially, you know, talk to people in other unions. When I know people a lot of people in sanitation and transportation, and that's a step. That's an important thing to do. Yeah. I know in the past I've spoken at the city council, and that's a good thing.
Jackie, your thoughts? This passes. What's the next course of action beyond even that city council? Are there other things that can be done to organize?
Can you hear me?
Yes.
Okay. I agree with the previous speakers. I think reaching out to city council members and even state politicians to get the word out on this issue and how horribly wrong it is, and also get the word out to outside agencies. Maybe we can get some outside support that would help us change this. And in the end, I do think that there should be accountability for this. And if our current leadership feels that this is a good deal for us, I think they're incorrect. And I think that they should face the consequences of not being voted in because they're not doing a good job in terms of representing the retiree interests.
Right. Marion, thoughts as to if this passes, what are the next steps here, course of action?
Well, it's if it passes, people are going to have to make a as informed a decision as they can regarding whether they want to go with the Medicare Advantage or whether they want to stay on traditional Medicare and buy their own supplemental. And they're going to have to weigh whether they can afford it versus the quality of the healthcare that they want. We're going to have to find out whether such decisions can be reversed. Like, can you go with the Medicare Advantage for a year and then revert to regular Medicare? You can probably find that out by calling up Medicare and speaking to a representative, or vice versa. We're going to have to find out whether the union's going to say you can switch the Medicare Advantage, in the future, even if you don't do it now. There's a lot we don't know, but I think if this does become the policy, I don't know why people keep saying it passes. No one's voting on it. Then I think we have to share as much information among each other as we can. And but ultimately it's going to be each person's going to have to make a decision with their budget and their priorities in mind.
Could I say one thing?
Go ahead, Jackie.
My understanding is the city can't force you to take a Medicare Advantage plan. That you are, as a Medicare recipient, you can choose a plan.
Absolutely.
The question would be, what benefits would you lose? What reimbursements would you lose if you take their plan? Are you paying? So there are many, many things to consider. And the original agreement with the municipal labor union states that this change should take place July 1st. We don't have enough time to do that comparison. So at the very, very least, we should be given more time. And I mean like another year to really make sure that we have the right plan and continuous coverage, because that could be a little tricky. And that's really what I have to say.
Thank you, Jackie. James, next course of action, this likely will pass. What other actions can be done to organize?
Well, I think beyond reaching out to the city council and our other union brothers and sisters, which I think are both great ideas, I think we should reach out to federal people also, especially AOC and Bernie Sanders, who are big supporters of Medicare for all, because this is a big step backwards. And the mayor is supposed to be one of Bernie's supporters and a big progressive, and he's looking for his next job. So wouldn't it be a pretty bad look for him to be privatizing healthcare for hundreds of thousands of municipal worker retirees?
Very good.
Thank you, James. We'll take one or two more from the audience, and then we're going to go into our wrap up with Bennett and Norm. If you would like to add comment as to action, please go ahead. Raise your hand in the chat, and I'm going to lower hands again. And if you have any ideas as to, I see Janet Coburn has a comment for us as to action. All right, if we could mute James, if someone can help me on that end.
Hi, James.
All right. Janet, I think you're on.
Yeah, can you hear me?
Yes, we can.
Right. Okay, so a couple of things. I live in Oakland, California, and there are many retirees who are outside of the New York City metropolitan area. So I don't know how all this is going to affect us, because we have not as much benefits as the people in the metropolitan area. But that said, I have been, well, I don't know, for Tuesday, there's a UFT RTC Facebook page that I didn't hear that mentioned. And that is an official Facebook page now. And so there have been discussions on that about this, but not very informed. And one idea could be prior to Tuesday and or just flooding that Facebook, people join that and flooding that. But what about an injunction? Is that a possibility? I know that would cost money, but what about
Definitely a possibility. It might, maybe RA want to think about setting up a GoFundMe for an injunction, maybe moving forward. That's something definitely within reach. Absolutely. I'm going to take one more. Thank you for those ideas. Harvey Lichtman, we're going to promote you to the mic. What would you like to add?
I think in terms of tactics for both before and after it goes through, and I think it will go through because they don't care. We are in a country, I mean, the point of tactics comes out of what is the conditions you're facing. And the pandemic has been allowed to kill 370,000 people. Okay, that's the type of government we have. We had the Democrats as a whole are not doing different than Trump, and the union is the basis of the Democrats. And what we need to have is an independent development organization of the union. Okay, which I mean, Randy Weingarten is on the DNC. You know, this is De Blasio, Cuomo. The Democrats haven't been any better. Right now, CUNY and NYU grad students have been on strike, and there is no unity at all. All right, the unions are not for taking any action. Okay, that's why they were defeated in Alabama and Amazon now. There are strikes across the country. You don't hear about them. Steel workers and coal miners and people are very angry since the pandemic intensified all the attacks on the working class that were going on before. And that's going to be on education too. So it has to become a greater social issue. All right, and who you turn to is not appeals to the MLC and the UFT. It has to be turning out to all the other workers in New York. I mean, they're all under the same gun, and they will be facing the same thing if they do. Somebody said it. If they start with the retirees, then they will go on to everybody else. The transit workers have had the same issues. One more thing: the city workers held a rally yesterday. All right, because they are being forced back to work. A lot of people are very angry. So any appeals have to be made much broader. This is what the Educators Rank and File Safety Committee, which is part of a network has been doing. And I encourage people to go on to wsws.org/safety. Okay, and join it. Well, yesterday we launched an international workers alliance of rank and file committees. That's got to become the approach.
Thank you, Harvey.
Should have.
All right. I think Dr. Moore had another comment for us. Dr. Moore?
Yes, I just sort of wanted to highlight 2 points that I heard that I wanted to make sure didn't get lost. One individual made a comment that you cannot be forced to take the Advantage plan. Medicare is yours and you paid for it, so you could opt out of it as an individual. The problem is you would not have that 20% that's probably covered by the union and the additional advantages. So that's one. The second point I heard someone make is the question that I would ask the union leaders is, this plan, will it be portable? If I live in Florida half the year, will I have coverage when I'm there? And I'm pretty sure the answer is going to be no, because Advantage plans are uniquely local. So I think that's probably one of the biggest issues that's going to make a big difference.
Thank you, Dr. Moore. Absolutely something to think about. All right.
Dr. Moore, I believe they will probably have people, they will have coverage in Florida. I don't think there's any question about it.
But what about
I mean, it will be portable enough that you, as long as you live in the United States, you can go to a Medicare doctor and they will be covered. It has to be. I mean, you can't run a system. What do you mean? People in New Jersey are not going to have care. I think they will do that. I don't know because I've never seen it, but I
Well,
just wanted to say
without
that is
arguing the point,
probably.
though, I just want to make the point that an Advantage plan is a specific thing. It actually is, if it were portable, then it would be regular Medicare. The Advantage plan is county-based. It's based on the locality. The premiums are based on that. And I do have patients in who live in other states, and they literally come back to New York for their health care, even though they may live in another state.
Well, we'll have to find out when that's announced, won't we?
Important to find that out.
I think they will cover it.
Thank you. If moving forward, I want to thank everyone tonight for enduring and listening in on really just a call to action. My name is Daniel Alisea. I'm with Educators of NYC. Please visit us at educators.nyc. I'm going to pass it on to Bennett and Norm, who are going to wrap up tonight.
Yeah, hi, everybody. Hey, thank you so much to all the panelists. It was really great to hear everyone, and I got so much information from Dr. Moore, especially about the differences between traditional Medicare, Medicare Advantage, and also a bit between HMOs and PPOs. And I think that's something that's going to be, used by the leadership to try to really sell that to us. And it was very interesting for me to hear about the sort of window dressing improvements that we want to watch out for. I mean, window dressing doesn't make real policy. And everything that, I'm sorry that we have so many questions still left and that we have to have the UFT answer for us. Because I mean, everything that has been said here tonight has been said because there hasn't been any transparency from the city and our union leadership or the Municipal Labor Committee. So we're stuck trying to educate ourselves about the ramifications of Medicare privatization. And we want to be very careful not to invent doomsday narratives and spread information or needless fear, but we have to call for sunshine. We have to get the message across through through our questions, through our posts, that they have to stop and listen to us. And that's why I support the Retiree Advocate UFT's motion for a pause towards privatized Medicare. And that's on the UFT Delegate Assembly's agenda. And it's very similar to the resolution that was passed by PSC and the CUNY retirees last month. But it's interesting to me that our voices are getting attention because our letters and our emails and the phone calls and the petitions and our social media posts are what have pressured our union leaders to respond, to us. As James was talking earlier, the UFT has been pressured into holding this town hall for retirees on Tuesday night. And that's a really good thing. And I'm looking forward to it. And I hope to hear more than the meaningless platitudes we heard at the last retiree teacher chapter meeting. I don't want to hear this Medicare Advantage referred to as a white glove concierge service, as if we're going to buy that. I want to hear more than blithe assurances that whatever is agreed to for us will be the best of all possible worlds. I want to get nitty-gritty, specific analysis of the actual plans in question and what they will mean to us. I also want to know what, if any, cost-saving measures other than privatization are being considered. I mean, we're all retired teachers here. I just spent the last 20 or so years of my life dealing with education deformers who tried and are still trying to destroy my profession and to crush our union as they extol the virtues of privatized education.
Right.
So it's hard for me to understand how the UFT can possibly believe that healthcare privatizers are any more virtuous than education privatizers. If there is one thing that our concerns over Medicare privatization are showing us, if there is one thing we've learned during this pandemic, isn't it that we have an urgent need for universal single-payer health care for all? I know we spoke about that here tonight. I mean, employer-based insurance only works as long as you're employed. 2 of my 3 daughters lost their employer-based insurance over the past year. They come from a union family. That doesn't matter. They lost their insurance. How many of your children have lost theirs during this pandemic? Perhaps we wouldn't be facing this privatization crisis if our city unions weren't burdened by the business of negotiating health care for us. With universal single-payer health care, we would be better leveraged to fight for the things we really care about: smaller class sizes, fairer wages, greater resources for our children, and better working conditions for our in-service colleagues, all of whom are going to be retired and on Medicare, if God help that they survive long enough at some point. We wouldn't even be talking about networks and givebacks and fees and services if we only had some transparency. And that's why Retiree Advocate UFT supports the New York Health Act. And it's why we would like to see a Medicare for All type health program in this country for everyone. And it is why Retiree Advocate will keep working with the UFT, which we support and want desperately to be on the right side of history, to join us and our union brothers and sisters in advocating for the New York Health Act and nationwide single-payer health care. And it is why I urge UFT retirees to vote for the Retiree Advocate UFT slate in the upcoming RTC chapter elections. But right now, it's one step at a time. So we're asking the MLC, our union leadership, give it a pause, engage with us, really engage with us, and let's save our traditional Medicare Part B healthcare. And thank you, everyone. I'm going to hand it off to Norm, who's has a few words about the upcoming retired teachers chapter election. Thank you.
Okay, hi. So Retiree Advocate has been around for decades and has been the only force inside the retiree chapter of the UFT that has pushed back. I've only been around with the group for about 5 years, and it's been a great group to work with. It's a non-sectarian group, has people from all the different caucuses, plus independents. We are, every 3 years, we get to run in the election. Otherwise, Unity would run unopposed. We are running for, Gloria is running as our standard bearer chapter leader against Tom Murphy. We're running for 12 executive board, 12 officer positions, I believe. I think 25 exec board, and they have 300 delegates to the delegate assembly. Unity runs all 300. We got about 130 people running. Unity, it's a winner take all. So if we got 49% of the vote, Unity would still get all 300 delegates in all the positions. That's democracy in the UFT. So with the ballots are going out like in about 10 days, and you have a couple of weeks to vote. A lot of people don't even know this election exists. And so one of the aspects of this, why we think we don't expect to win, but we do feel that if our vote increases significantly, that this will put pressure on the union leadership, because they control the UFT through the retirees. There are 70,000 retirees, and this is we get a leaflet. Our leaflet goes out at their expense to all 70,000 retirees that we've written. Unfortunately, the deadline for that leaflet came up right against the point that we were finding out about this. So all we were able to get in was a little note at the top warning that this was about to happen. So we we urge you to look for the ballot, to tell your people that this election is happening, and to try and get people to vote for us. And I'm going to shoot this back to Gloria for the final word. The next chapter leader of the retiree chapter, Gloria Brandon.
Sure, I want to win. That would be interesting. Anyway, it's getting late, and I want to thank everyone who's still here. We had up to 300 people at one point. We now have 167 people who are still with us. Thank you for staying. The results of the rally poll was 35%, which was 38 people said yes, 65%, which was 70 people said no. I'm seeing some people in the chat are saying they didn't get the poll, but we got to think some more on that. The energy here is great. A lot of great ideas. So I think what we will do is we will send to everyone who's on this call, we will compile the main points and we will send it out to you. There is an online Google Doc that I posted a few times in the chat, which does have some suggestions, things we can do, which many people have been doing, and I'll send that back out again. I think trying to do something on Tuesday during the 1 p.m. Town hall that Mulgrew has told us about. Some people were asking for that link. When I got that email, it said you couldn't share the link with anyone, and that wasn't the link to sign on. That was the link to register. So I would suggest you go to the website and see if you can find it or call them up. But do get on it, and if we can think of a way to blast them with questions, we really need to do that. Some people here were making some great suggestions. Contact other unions. As far as I know, the only union right now that is talking about it and doing something is PSC. I did contact somebody, a friend of mine in DC 37, and he said he hadn't heard about it, but he'll see what he can find out. He never got back to me. So that tells me something. So if there's a group of, if some people would like to try to find out if what other unions might be doing and form a committee to do that, please do that. It's a lot of work. Put it in the chat if you want to do that. Write in the chat if you want to organize a letter writing campaign, phone calling. There are things we can do. The more stink we make, the more attention we make. We know it makes a difference. That is why Mulgrew is having this town hall. Would he have had this town hall if we didn't do what we did? Anybody want to bet me? I'd say no. So again, this is a hard one. Because even if this passes and there's no changes this year or next year, they're going to renegotiate it in the future. And we know it probably won't stay as good. Now, people have said that already, but I have to reiterate that because I really do believe that. So again, I will end. I wish we could have answered all your questions, but I hope we've given you some energy to move forward and not take this lying down. So we'll be in touch. Please email us at retireeadvocate@gmail.com. We can add you to our email list. We are going to probably start getting more members involved, which we haven't been doing. There's so much else going on, so we're not going to bother with trying to get you to join us. But please stay in touch. And thank you all.
We hope to post tonight's session, or most of the session was recorded tonight, on the Retiree Advocate UFT Facebook page. That's facebook.com/Retiree Advocate UFT. And another great suggestion is some of that phone banking. Blow up the UFT lines the next couple of days. I think that might help. Good night, everyone.
Good night. Good night.
Good night.
Night.
Good night.
Good night. Guys, great job. Excellent. Everyone was great.
People are still
Wonderful.
leaving. People are still here and leaving.
I thought it was very nice. I think it was. I learned. I learned a lot. I thought I knew stuff. I found out I didn't. So.
Okay.
Whoa.
How do we? Okay, so as people leave, I don't know, is there a way to, how do we end it?
Go to sleep. That's all.
Oh, I know, I could at least